I just want to thank, first of all, I want to thank the Tennyson Center for Children for hosting us today. It is an amazing, amazing facility. And one thing I love doing is talking to students. So when I first came this morning, I went to a classroom and talked to students. And just to tell you sometimes how it works out, a couple of weeks ago I met with a group of students on the Capitol steps in Washington, and I gave them my little spiel and everything, and I was standing there. They're all on the Capitol steps. And I said, "Are there any questions?" And one of the children raised up their hands, and I said, "Yes." And they said, "Who are you?" This morning, I went to the classroom and I gave my little spiel, and I said, "Are there any questions?" And one young woman raised up her hand, and I said, "Yes." And she said, "What's the current status of stem cell research? And is it being used in adults yet?"
Yay!
That's what the Tennyson Center is doing for these kids. Let's give them another round. Katie, I want to thank you for hosting us and for being here. Steve, I want to thank you. Steve and I have been fighting this battle together even longer than Max and I have since I was in the state legislature. And Jesus, your organization is such a fantastic, fantastic group advocating for everybody. And it's like Max said, as I sat here and listened to all of the speeches that everybody made, I said, you know, they must have gotten an advance copy of my remarks because they're saying everything that I think too. But really having folks show up here today to talk about the devastating effect that these budget cuts and this sequester has on Americans, and having this alliance between advocates for children and advocates for seniors is so powerful and so important as I take your message back to Washington. So I want to thank all of these wonderful groups for coming together, but I want to thank you for taking the time to come out in the middle of a beautiful, beautiful early summer morning here in Colorado. And I am looking forward to hearing from you, but I want to underscore a couple of points that the other speakers have made this morning. People have been talking about this sequester, and as you might recall, the sequester was enacted in 2011 as the latest. Someone referred to the fiscal cliff. Seems like we've got a fiscal cliff about every 2 or 3 months in Washington, all self-made by us. We have some new fiscal crisis every few months, and we're scrambling to try to how to get around it. So we had this fiscal cliff that was looming. We were about to default on our international obligations. So politicians came up with this. It was mutually assured destruction is what it was. It was a policy that said, if we don't negotiate something to help us get out of our fiscal difficulties, then we're going to have these draconian, mandatory, across-the-board cuts, known as the sequester. And it was so bad. The thinking was it was so bad, and it affected everybody in a meat axe kind of a way, that politicians would get together and fix it. Well, I've been there for a while. I've been in Washington for a while. And I've developed one rule. Actually, I had this rule when I started, and I've never wavered from it, which is don't ever vote for something that you disagree with, hoping that it'll go away later on, because it usually doesn't.
That's it.
And I said at that time, I'm not going to vote for this sequester because I think it's horrible, and I can't guarantee that it'll still be there. And so I voted no on the sequester, and I'm very proud to stand here. I hate to be right in a circumstance like this, because what happened? The sequester went into effect, and sure enough, it had these draconian cuts that affect the very core of what we are trying to do in our communities. With the students upstairs just a few minutes ago, one of the young women who asked me the question about stem cell research had a very personal reason for asking that, and I had to tell her that I learned just last night that a medical researcher at the University of Colorado has had one of his applications that would affect her, this young woman, has had one of his applications cut because of the budget sequester. And the cuts that we've had to the National Institutes of Health, to the Centers for Disease Control, to the FDA, and to all of our agencies that are doing research to help folks who have diseases. Some examples of the cuts that we've had right here in Colorado, several of the other speakers talked about Head Start and early Head Start services. Those are going to be eliminated under the sequester for about 700 children in Colorado. And you know, as you know, Head Start is for 3-year-olds. So it's not like next year we could just give it back and have them do it, because they'll be 4 by then. So that early childhood education won't be available ever for those 700 kids. For primary and secondary education, we have 120 teacher and aide jobs at risk in Colorado. For job training, now it would seem to me if we're trying to get our education back on track, what we should be training workers and retraining folks who need to go into new jobs. We're going to lose about $331,000 in funding for job search assistance, which means about 14,800 people will not be able to get the help that they need to find work. That just seems to be counterproductive, just like all these other cuts. In healthcare, you want to talk about kids' health, Steve, about 2,240 fewer children will get vaccines this year. And hepatitis B vaccines, all these other vaccines, the funding is going to be cut by $153,000. And we talked about the environment, which is so important for all of us, all Americans. Colorado is going to lose $2 million in environmental funding for Clean Air Act and water quality. And so you know, these are just crazy priorities. These are things that we won't be able to get back, and it's just wrong, and we can't let it continue. And so we really need to look going forward about what we're going to do about this budget. And I'm going to talk about that in a minute. My remarks talk about what the Republicans' budget, for the Paul Ryan budget in the House, does to Medicare and Social Security. You've heard some about that from our other speakers, but just to kind of put a fine point on it, the budget dismantles and privatizes Medicare, and it slashes $810 billion over the next 10 years. Max talks about the money from the change CPI. The $812 billion is money coming right out of the pockets of seniors. And what the Ryan budget does, is it replaces Medicare with a voucher that would drive up out-of-pocket costs by $5,900, and then also reopens the donut hole that we were able to substantially close in the Affordable Care Act. And so I mean, it is not a good situation on top of the sequester in the Ryan budget for Medicare. In Social Security, what the Ryan budget does, it also partially privatizes Social Security over time. And you know, Social Security is the promise that we made to seniors, that if they worked hard, they played by the rules, they put their money into this trust fund, then they would be able to have these benefits when they retire. And it's, I mean, probably a large number of you are on Social Security, and you can attest to this. It's not like people are getting rich on Social Security, right? They get about $1,200 a month on average. A couple of months ago, I was over at Rosalinda's. Do you know where it's right over here? I was over at Rosalinda's helping serve Thanksgiving dinner. They do that every year, and I like to come over with my family. And I got talking to a gentleman and his daughter, and he was telling me that if his CPI, or if his COLA goes down, he's not going to be able to pay his electric bill because his electricity costs have gone up so much the last few years. So, you know, here's a fellow, he's living on Social Security, which is the promise we made to him and which he paid into every month when he was working. He's making it, but he's not making it rich with Social Security. And now he's looking at politicians in Washington saying they're going to cut his benefits by cutting his COLA. Now, I always remind people, you know what the COLA is? The COLA is the cost of living increase. So it's based on actual costs, food costs, rent and housing costs, utilities, transportation, all of that. So as Max says, if you do this change CPI, what that does is that simply changes the formula for the COLA to make the benefits less to seniors for the things that they have to pay for. And that's why I think that's a bad idea, and I don't think that's the way to solve the fiscal problems that we have right now in Washington. And as the other speakers have said, Social Security and Medicare are not the things that are breaking the budget. As a matter of fact, the Social Security and Medicare trust funds are still robust. We probably do need to sit down, Max and I have talked about this, we do need to sit down on a bipartisan basis and figure out ways to keep the Social Security and Medicare trust funds solvent for future generations, but not by impacting current seniors and not by holding the rest of the budget hostage to these conversations. That's not the way to do it. And so going back to the Ryan budget, I could go on and on about all the and my staff very thoughtfully in these talking points did go on and on about all of the terrible things that the Ryan budget does, like repealing the Affordable Care Act. By the way, we just voted the 37th time last week to repeal the Affordable Care Act. In case you didn't realize that the majority in the House doesn't like it and wants to get rid of it. So, you know, I keep telling my chairman, wouldn't we really be better off, instead of having these votes that are meaningless, to actually sit down and do oversight about how we can implement the Affordable Care Act in a much more thoughtful way, and if it needs to be fixed. So, and there are also many, many, many other cuts in the Ryan budget. I pointed out yesterday, we had a meeting, the delegation had a meeting with the federal judges here in Colorado, and they're affected by the sequester too. And I pointed out that it's not just right now that we're affected by this sequester. The sequester is supposed to take effect over the next 10 years. And the Ryan budget and the 2014 budget and appropriations bills that Congress will be voting on when we go back next week are based on the numbers of the sequester. So if you think this year is bad for Head Start and for seniors and everybody else, wait till you see next year and the next year and the next year. And so it is really an imperative that the citizens of this country stand up together and say to all of their elected officials, not just people like me who agree with you, but everybody, we've got to put an end to this. We do need to balance the budget. We do need to have a comprehensive conversation, but not on the backs of the people who can afford it the least, the children and the seniors of this country. And so, I'm happy you're here. I'm happy to work with you. And right now, I'm happy to take questions. Thank you very much.